Hi guys, welcome back to my channel. Nikki's here. I know it has been a long time since I last posted on this channel, but I am on break finally. There's only a few days left, but I really wanted to come here and make this videos because I thought it would be really cool to show you guys what I do on a daily basis at school. Well, it is going to be my career, so I just want to share, and I thought it would be interesting to show you guys what a life of an ultrasound student is like, or soon to be a professional sonographer. Okay, so today's video is gonna be like a role play, since this is the best way, I guess, to like show you like how it works, like what we do on a daily basis. So pretty much sonographers are ultrasound tech. What we do is we perform ultrasound exam on different parts of the body to help doctors figuring out like what's going on with these patients, why they have these symptoms, like what is their organs looking like inside, something that we can be visually, see and detect, and just assist doctors diagnose patients. So yeah, the videos today will show you my interaction with patient. Won't exactly show you how I scan because I don't have the machine here at home, but the probe looks something like this. But yeah, you have an idea of like how to interact with a patient, walking them through the exam, how to like inform them of what's gonna happen next, things like that. So I thought it would be interesting, and yeah, let's get started. But before we get started, I just want to let you know, since there are no real tools that I have at home, so I'm just gonna improvise and use my lotion bottle as a gel bottle. And I actually do have a real hand sanitizer bottle, so that's a plus. Would you have to use hand sanitizer a lot, or even better, you can wash your hand. Everything that you touch, like before you touch the patient, you have to wash your hand or use hand sanitizer after you touch like any objects. Like after that, you have to change your gloves and put on hand sanitizer. Oh, and another thing, we do use gloves when we scan patient, but I don't have any at home, so I'm just gonna pretend to put them on. So yeah, just some facts that I'm gonna be showing you, that this is not exactly what happens at the hospital, because there's so many steps to, like properly following the protocol. But I'm just gonna pretend, say, okay, I'm putting on my gloves now, things like that. For today's exam, we're gonna do a complete abdomen. It takes about 35 to 40 minutes. We look at everything in the abdomen: liver, kidneys, spleen, pancreas, etc. So I'm gonna walk you through as a patient. Shall we get started? All right. So I'm checking on my Epic, my schedule, and you can see when people checked in, when they're ready to get picked up. So let's see. Okay, Mr. Smith here is ready. So I'm gonna print out the paperwork, take the paperwork, walk out to the waiting room, and then I will call their name. We can only say either first name or last name. You never disclose patient's full name. That's just HIPAA law. So, okay, so I would call Mr. Smith. Hi, my name is Nikki. I'll be your sonographer for today. Can I see your wristband? Just double check full name, date of birth, that they have the same name and date of birth as on the paper that you have, because there are people who have the same name, and trust me, I've seen people who have the same birthday too. So, well, it never happened that they have both same name and same birthday, but just one letter difference can be a huge problem. You don't want to get the wrong patient into the room, so just check before you bring them back. So yeah, Mr. Smith, do you mind if I can check your wristband? Just want to make sure that I have the right patient here. Okay, perfect. All right, so again, my name is Nikki. I'll be your sonographer for today. Please follow me back into the ultrasound room. You can, ask them how their day's going. So how are you doing today, Mr. Smith? You doing well? Alright, we'll be in room 2 today. Please go ahead. You can take a seat there. on the bed. If you want to take off your jacket and hang up, I have a hanger right over here. I can take your jacket if you like. Alright, so Mr. Smith, can you confirm your full name and date of birth for me one more time? I know, I'm sorry, I'm asking you so many times. It's just protocol that we have to follow here. Perfect, thank you so much. Okay, so tell me a little bit about what's going on. Do you know why your doctor ordered this exam? Hand sanitizer. So you've been having this abdominal pain for how long? A week? And is it hurting right now? Okay, not too bad. Do you notice that it hurts more after you eat, or not really? Okay. Do you think you could point to me where exactly it hurts? Back there? Okay. So, Mrs. Smith, have you had any surgery done in the past that you can remember? Always confirm if they've had any surgery. Some people forget. No surgery. Okay. Perfect. And have you ever had an ultrasound done before? Yes, you have? A long time ago? Okay. Well, I can explain everything. It's a pretty simple exam. Literally, it's pain-free. I'm gonna use some warm gel here. And the warm gel will go on your abdomen. And then I'm gonna use this probe here. Just to go over a certain area and try to get the best images that I can for the doctor, okay? So all these images are going to the radiologist here, and then after they review everything and come up with like a differential diagnosis, they will send the result to your doctor, and your doctor will get you give you a call and get your result to you in about 2 to 3 days, so you won't get the results right away today, okay? Do you have any questions? No? Okay. Yes, if you want the result mailed to you, I can set you up for that after the exam as well. Okay. Alright, so if you're ready, we'll get started. Now this exam will take about 35 to 40 minutes. Depends on what we see, okay? But usually it takes about 35 to 40 minutes. Alright, so if you're ready, we'll get started. I'm gonna get some towel here. What I'm gonna ask you to do, you can just lift up your shirt and then tuck this towel under your shirt there. Perfect. Okay. So I'm gonna try not to get the gel on you, but I can't promise you because this stuff gets everywhere. Alright. And Mrs. Smith, okay, so we are going to be a team here in just a moment. Pretty often I will have to ask you to take a deep breath in and hold it. Now whenever you feel like you have to breathe, just breathe. But if you can hold it for as long as you can, that would be great. But again, don't worry about it because we can always take a deep breath again. So if you feel like you need to breathe, breathe. I don't want you to like pass out on the table, okay? Perfect. All right. So we will get started, okay? So you will see me looking at the screen over here because I'm scanning you, but my screen is over here and I will be working the machine from this angle. So I won't be talking a lot, but I'll try to walk you through the exam, okay? So you know what's going on. All right, so let's get started. Here's some warm gel. How are you doing so far? Temperature is okay? I know it's nice. We warm it up for you. All right, Mr. Smith. So I'm starting here. Looking at your IVC first. All right, can you take a deep breath in and hold it for me? Deep breath and hold. Perfect. Breathe. That was a really good deep breath. You did a great job there. Okay, I have to push a little more, okay? Let me know if it's too much. Perfect. Give me another deep breath in and hold there. Deep breath. Hold. Perfect. Let it out. Breathe normal. You're doing great with the deep breath. Alright, so we are done with the IVC there. I am going to move down to your aorta now. The largest artery in your body. Okay, more pressure. How are you doing? You okay? Okay. Okay, Mr. Smith, this time can you try to push your belly out? Make it big for me. Like Santa Claus belly. Perfect. Hold it out. Perfect. Breathe normal. How are you doing? You okay? Alright, almost done for the aorta, okay? Perfect. Beautiful images. Alright, so we are done with the IVC and the aorta. I'm gonna try to get your pancreas here while I'm in the same area. So your pancreas is behind your stomach, and we're a little gassed out here, but I'm gonna have to push a bit more, okay, Mr. Smith? How are you doing? You doing okay? Alright. Give me a deep breath in and hold. Beautiful. Perfect. Breathe. Okay, we're done with that. Now let's move on to the liver. So your liver is a really big organ. It's stretched all the way from your right side to the middle and sometimes to your left. So I'm going to start with the left lobe here. Give me another deep breath in, deep breath, and hold it. Hold. Beautiful. Breathe. How are you doing? I know it can get really tiring after a while, but almost done with the liver here, okay? We're moving on to the right lobe now. Another deep, deep breath in and hold it. Great breath. Breathe. You're doing great. Okay. Let me tuck this towel a little bit under this side here. Perfect. And I'm gonna wipe some of that off because I'm done with that area, okay? How are we doing? I'm gonna flip you in just a bit because we're going to take a look at your gallbladder, and we have to look at that in two different positions. Alright, another deep breath in and hold. And breathe. Great. Another deep breath and hold. Hold, hold. Breathe. Beautiful. Alright, are you ready to turn? So now I'm going to ask you to turn and line your left side and then keep your right arm up, so facing that wall. Perfect. Thank you. Alright, just looking at the gallbladder in a different view here. Okay, this time push your belly out again, make it big. Hold it out. Perfect. Breathe normal. You're doing great, Mrs. Smith. Okay, so while you're in this position, I'm just gonna get your right kidney as well, okay? Okay, actually that didn't work so well. Can you lay back on your back for me? Perfect. Thank you. How are you feeling? You okay? At any point, if you need a break, you let me know, okay? Sometimes people get dizzy, so if you need a break, we can stop. Alright. Another deep breath in for me. Deep, deep breath. Some pressure. Breathe. That was a long breath, huh? You did great. Alright, last breath over here. Deep breath in and hold it. Breathe. Mr. Smith, we're halfway done. Actually, more than halfway. We're done with the right side. Now I'm gonna turn you over to face me this way. So you're lying on your right side, and then keep your left arm up. So on this side, we have your left kidney, the spleen, and then we're all done. Okay, another deep breath in here. Deep, deep, deep. And breathe. Beautiful. How are you doing? You still doing okay? Just a few more images, okay? Okay, I'm gonna throw the color on here as well. You see the blood flow. Alright, ready? Another deep breath in. Deep, deep breath and hold. Perfect. Breathe. Okay, 2 images and we are done. You're doing great, Mr. Smith. Okay, I'm taking a long view of your spleen here. Your spleen is right up against your diaphragm on the left side here. Sometimes it can get tricky to get it because you have all the rib shadows there. Alright, ready? Deep breath in and hold it. Hold. Breathe. Perfect. Last image. Okay, whenever you're ready, give me a last deep breath here, Mr. Smith. Deep breath. Beautiful. Hold it. And breathe. And we are done. Okay, so let me wipe you here. Here's another towel if you need. Just wipe it off. Okay, you need help getting up? How are you feeling? Is your head feeling okay? You feel a little dizzy? You take your time. You okay? Alright, here. Let me give you a hand. Up. Okay. Okay, Mr. Smith, so again, these images are gonna go to the radiologist here. The radiologist will review everything and send the result to your doctor in 2 to 3 days, and that is when you get the result. Jean, do you have any other questions before we leave? Okay, so when you're ready, I'm gonna give you a moment to clean up. When you're done, just open the door and then I'll walk you out. Thank you so much for coming in today. Yes. Oh yes, I do have to get you the form to fill out because you want this result to mail to you as well. Okay, so yeah, just get changed and then I'll get the form for you and then I can walk you out. Perfect. All right. Bam, and that is how it's done, my friends. So we have a lot of different exam, and some of the exam are really intimate, like the transvaginal, scrotal, and then some like woman imaging is like a breast exam. So for those, there's a lot more that comes to it when it comes to like protocol, but this is one of the most common exam that we get on a daily basis, the abdomen. And also we get OB exam where pregnant women would come in and we scan and see how the baby is doing inside the belly. But yeah, I hope you guys enjoy this video. It's been a while, so I'm a little rusty with like recording voice and on screen, so hopefully I can match these up perfectly. But yeah, if you have any questions or any requests, let me know. I hope you enjoy this video. I enjoy making it. I do miss scanning, and I'm going back to school on Monday, so I can get my hands-on practice on. But yeah, hope you have an idea of what my job is like. Literally, we would just be doing this over and over during that 8 hours that you're at the hospital, or however long your shift is. Like some people work for 12 hours more, but right now as a student I do 8 hours, so yeah, a lot of fun scanning time. Okay, thanks guys for watching. I'll see you next time, and again, hopefully I can make more like sonography school related ASMR video. I hope you guys like this kind of topic, but if not, I also plan to do some fun video with slime again. I am obsessed with slime. Haven't you noticed? But yeah, I still have a big box that I want to like play with. So, alright, I'll see you next time.